Hello, I'm Brian Wolf with my friend Dr. Ira Weintraub. This month on the pain field, we're going to just ask a few questions and find out what the answers are.
I'm Ira Weintraub. I practiced orthopedic surgery for 40 years, so I have a lot of insight into hospitals and now lots of insight into payments. And so the paying field, we're going to talk about it.
Let's get started.
The system is geared toward maximizing profit no matter where you look.
So there's an aspect of it that's supposed to serve consumers, which would be minimizing costs, right?
The patient experience should be the focus. The problem is that many providers, hospitals, and physicians have gotten away from that because they're independent physicians, as if, for instance, not that they don't treat patients well, it's just that they're having a hard time surviving in this market, so that they have to look at their income and what they charge as much as they think about just patient care.
So that necessity is that polarizing that aspect of health insurance about making profit above or minimizing costs for the service of the consumer, and like is that what's weighing it one direction more than it should be?
I don't know what part of the industry is trying to minimize costs. I don't have any idea because I don't see that in my everyday work.
But isn't that whether it's a myth or not, but isn't that the general idea as a consumer of insurance? I want to go with an insurance company that has my economic needs as well as my health needs in mind, that when I'm going for insurance because I'm under the impression that if I have a medical emergency or a medical need, that it's going to be cheaper with insurance than it is without insurance. So the idea is that they are minimizing my cost, right?
That could be a fallacy because the fact is that commercial, fully insured plans with a major insurance carrier, Blue Cross, United Healthcare, Aetna, Cigna, all the big players, is almost not insurance anymore. It is a payment plan. It is a preset agreement between insurance companies and hospitals to make the insurance company assures the hospital they're going to get paid X. And so they then take advantage of the consumer, the patient, you, by paying a lot of times for things that they even say themselves they won't pay for because they have the contract is with the insurance company and the hospital. Consideration a number of years ago now, probably 10 plus years ago, where it was felt that a high deductible health plan would make a better consumer of healthcare, meaning your deductible, your out-of-pocket expense goes to $10,000.
Which would make the idea would make me more picky about when I choose to go to.
When you go, who you go to,
sure.
All that stuff.
That I'm going to be a more careful consumer.
The problem is that's not how healthcare works. People go to the doctor. People used to come and see me. Why? Because someone recommended that I was a good orthopedic surgeon. And they didn't check out how much I charged, because I don't know where they'd find that information anyway.
Sure.
It's not publicly available. So they would come and see me, and let's say I saw them and it wasn't something that necessarily I would take care of, and I recommended you go see Dr. So-and-so.
Mm-hmm.
And patients do not look at that and say, well, I gotta make sure this guy you sent me to is high quality, low cost.
Well, there's a lot of that I think has to do with that that persona of the doctor, knowing it all,
That's
trusting their gut.
That's the rub.
Yeah.
Is that's why people don't shop healthcare.
But also, like, who wants to go to a discount surgeon? Like, that sounds insane to me,
No,
right? Like,
Brian, you are 100% correct. And the ability for a consumer to find out, is this a high quality, low cost guy? Where are you going to find out about the quality? You're going to do Google reviews, 5 stars. The problem with all that is that the most common reason people go to that and rate their doctors because they're unhappy about something.
Right.
And so the
skewed towards
the overall gets really skewed. And then the cost part of it, that would be an impossible thing to figure out ahead of time.
Yeah.
It's impossible. Going back to the shopping for healthcare, because what I hear in my job today, which is in a company that looks at medical bills and understands what is in a medical bill, it is a fairly recent plan of there's an industry of people who supposedly, it's called steerage, where they will steer you to the hospital that is of supposedly higher quality and lower cost. That's where they're going to steer you. The problem with that is, if I'm doing surgery on you and you have to go into the hospital, you're going to go to Good Samaritan Hospital. Why? That's where I go.
Mm-hmm.
Now, if your insurance said you had to go to the other system, Providence, okay, I'd take you to Providence Hospital because that's where I do my surgery.
Yeah.
If you had an outpatient surgery and it was appropriate, I would take you to the surgery center that I was a part of because that's a high quality, better outcomes, better patient satisfaction. Surgery centers are just like that.
But you accommodate the patients in regards to their need and that has been dictated by the insurance or the steerage person?
The steerage person has nothing to do with it.
Okay.
It's only where I go.
Okay.
So we had a case the other day that was in big question because the doctor took the patient to probably one of the most expensive hospitals in the country, is in LA.
Yeah.
And why did he go there to do this spine surgery? Because that's where he goes. No, that's where he goes.
I was hoping for the best.
You're hoping for the best, right? Forever hopeful. But the fact is, that's not how it goes. Doctors go to hospitals based on where they have privileges. And you can't have privileges at every place in town.
When you say privileges, what do you mean by
Well,
that?
doctors get privileges at hospitals based upon their meeting qualifications. You're board certified, you don't have any significant negatives in your history. Maybe you had one malpractice suit in your whole life, so that would be okay. It's a like getting admitted to college.
Okay.
You have this resume of credentials that come with you. And as long as you're credentialed correctly, you get privileges at a hospital.
But what are privileges? Like a privilege?
I mean, you can operate there, you can admit patients to the hospital.
Okay.
So the thing that's important is that if you are on the active staff of most hospitals today, that also includes that you may have a requirement to, say, be on call in the emergency room for certain things.
Yeah.
Nobody likes to be on call anymore. Matter of fact, hospitals pay doctors to be on call that are on their staff.
That's just changed within the industry.
That's a big change in the industry.
Mm.
And the reason they have to do it is because call can be quite onerous. So you wouldn't want to be on active staff in 5 hospitals.
Yeah, because then
I once, in my practice, I was on call at 3 hospitals at the same time.
How did you manage that?
All week. I never stopped being in the car,
Yeah.
driving back and forth and back and forth and back and forth. It was horrible.
Yeah.
I quit doing it because I got out of that whole situation. And I went back to a much more manageable 2-hospital system.
So this provider that you're talking about, this doctor that specifically sent their patient to this very expensive hospital, they're doing that because what's the kickback for them?
None.
Okay.
None.
Kickback is maybe the wrong word. But what's the benefit?
The benefit for them is that let's say they're doing spine surgery, as this case was.
Yeah.
When they go into the operating room, they know you, they know what you do and how you do it.
Okay.
So you usually get more qualified people to help you in your surgery, because there are hospital employees that help you in the operating room.
So it becomes user friendly for that
For the doctor
to perform his work within
Exactly.
the environment
Exactly.
of that hospital.
And hopefully that translates into a positive for the patient.
Yeah.
Because surgery is all about technique, but it is also all about efficiency.
But that doctor's going to be like, I'm going to send you to this hospital because that's the one I like and it works, and I already know the staff.
Right.
I'm not going to send you to hospital B, which might be more economic for you and your insurance, because I don't have to, because I want to work at this one.
Exactly.
Interesting.
And patients don't question that.
Right.
Again, your comment about what the doctor says,
Yeah.
that is big. And the part that personally that really is an incredible responsibility for a physician, knowing that virtually everybody that walks in the door is going to believe what you tell them and going to believe in your ability to diagnose their problem and treat their problem. So it's not just doing what the doctor says, it's the fact that someone has entrusted you with the part of your life that no one else can deal with.
Right. Do you think health insurance takes advantage of that situation in regards to
Health insurance really doesn't care one way or the other.
there's not an aspect of them knowing that most people will default to their doctor's recommendation, and so they're not creating a situation that lets the consumer get educated easier?
Not usually. The education of the patient is directly from your contact with your doctor, their staff, and that's really the only education you get. Again, where to go and what to do, you do that because that's where the doctor does it.
Yeah.
And the insurance company, frankly, you pay your premiums. Again, your $10,000 deductible, you're supposed to be a better consumer, but the fact is that all that does is increase your debt.
Yeah.
Because the first $10,000, you got to come up with that.
Well, and you just save up at least for me, I'd save up my procedures and more than a year, and then I'd be like, okay, I'm due for 2 years worth in 1 year. Let's get it done. Okay, after 4 months, I met my deductible. I'm Golden Girls for the rest of the year.
And then there has been a very significant change in the American healthcare consumer in that they put off care.
Exactly.
They don't get care, even for chronic situations.
Yeah.
Patients can't afford to go to the doctor when they have diabetes or kidney problems or those kinds of things. They don't go because they can't. They can't afford it because their employer bought them a $10,000 or a $5,000 deductible.
Right.
Healthcare debt is crushing a huge number of people in the United States. It is one of the major causes of bankruptcy for individuals in the country. So this thinking that shopping for healthcare is a reality, so we're going to give you a higher deductible so you watch your money, doesn't happen.
So how does the average consumer get educated enough to be able to navigate this minefield? I'm truly asking that as a consumer. Even as I've become more involved in this industry, I'm still the knowledge that it is a minefield is that much more apparent. But I'm still like, I don't know how to get a metal detector.
The answer is kind of pathetic.
Okay.
Because education as to how you navigate this is only as good as the person who's giving you the information, first of all. And frankly, I would tell you that 99% of physicians have no idea what a hospital charges.
Yeah, you were talking about that with your own experience.
No idea. They have no idea.
So you're not going to get the provider to educate you. It's not in the interest of the health insurance to educate you. So
because they just tell you, go to your in-network hospital. This is what we cover. That's all they tell you.
Yeah. So again, you're just left to your own means. And Google.
In a lot of cases, that's unfortunate.
And having the time and energy. I mean, most people don't.
And can you pony up the money when you walk in the door,
right?
Or when you get the bill.
Well, and like a lot of people, unfortunately, reach these revelations as they
and when they get the bill.
Exactly. Yeah.
You can ask the hospital for an itemized statement of what happened to you and what you have done, because I have people send me their itemized statements, friends, and they said they didn't do this, they didn't do that.
Yeah.
And so that is where I see on the payment side, I believe that payment integrity companies, and unfortunately the United States has many of them, but I think that the companies that understand the medical treatment and understand how billing goes will be the way that at least that makes me hopeful people will become more educated about about the whole what it takes to get your health care, what financial implications you have with health care, which you hope that the quality is the same, but you really are you're at the mercy of these large institutions. But a consumer can educate themselves, and my first thing that I would recommend to anybody who went in the hospital is to get an itemized bill.
So are you saying if I got an itemized bill, which is obviously a request that could, that first step to educate myself, and I see something on there that didn't happen, am I as a consumer empowered to contest that?
Absolutely.
See, I don't even know that.
Absolutely.
I didn't even know that.
I would. I went to the emergency room once myself, and I needed to have an endoscopy.
Mm-hmm.
And I knew that before I went in.
Yeah.
And basically I went in because I was going there to meet the gastroenterologist and the anesthesiologist to get it done. But I went through the emergency room. There was no other way to do it. And I got charged $800 for the physician visit. Not the guy that did the endoscopy, the emergency room physician. I never saw the emergency room physician. They never came to see me. All I got was my blood pressure and pulse taken and my temperature by the nurse, and I just sat there and waited for the guy to come in. So I contested that bill, and I said, I did not see an emergency room physician. That's all there is to it. I'm not paying.
And so you just had that conversation with the hospital as a provider?
I
Billing department?
I called the billing department and
Yeah.
said that I didn't see a physician. And I don't think it was probably in my chart that I ever did either. But
I was going to say, is the, what's the word, onerous? Is the responsibility of proving that on you or on them?
Well, they would have to prove I did.
Okay.
But
Interesting. I mean, that's a nice takeaway as far as I'm concerned in regards to be like, okay, that's something that I did not know I had the power to do.
I believe a consumer has that power. And I also think that hospitals are not in the business of knowingly, in that situation, knowingly ripping you off.
Mm-hmm.
As a whole, do they overcharge people and get what they can get? Sure. But in a situation that they were questioned, I think you have a lot of power in that situation.